Alzheimer's, seizures, growth retardation in children, nocturnal enuresis, lack of study concentration in children, even migraine, and endogenous depression. Coming to specific symptoms of an aluminum toxicity, it's an encephalopathy which normally we see with high serum aluminum levels, like stuttering, gait disturbance, myoclonic seizures, coma, and abnormal EEG changes. Osteomalacia and aplastic bone diseases, they are associated with painful spontaneous fractures and hypercalcemia, proximal myopathies, and these are associated with higher levels of bone aluminum. Increased risk of infections, increased left ventricular mass, and decreased myocardial functions and microcytic anemias, they are related to the red cell aluminum toxicity. Aluminum toxicity impairs the formation and release of the parathyroid hormone and thus increases the chances of CNS toxicity of aluminum. Aluminum hydroxide is the most commonly used antacid, and you can imagine that it provides almost 5 grams of aluminum hydroxide every day, and this is several hundred times the amount we can normally accept. GIT irritation, colic, esophagitis, gastroenteritis, even appendicitis, these are common symptoms in aluminum toxicity. Workers in aluminum smelting plants, they experience dizziness, loss of coordination and balance, and fatigue. This could be because of the accumulation of aluminum in the brain tissues. We talk about a link between aluminum and magnesium. Now, aluminum is more likely to accumulate in the brain in a person who has got a diet deficit in magnesium. Studies show that the animals fed with diet low in magnesium accumulate high concentrations of aluminum in the central nervous system. Magnesium activates the enzyme tubulin, which is responsible for the maintenance of nerve tissue cells by plugging into the appropriate site at the tubulin enzyme. In the magnesium deficit diet, aluminum plugs into the tubulin enzyme instead of magnesium and results in impaired nerve conduction. Aluminum toxicity produces symptoms of poor calcium metabolism similar to osteoporosis, impairs absorption of selenium and phosphorus, causing muscular weakness, painful and aches and twitching. Consumption of aluminum reduces total bone as well as periostal bone and matrix formation, and it can also cause the motor nerve paralysis and localized numbness. So you can imagine that most of the symptoms we find in aluminum toxicity are the symptoms we come across in our day-to-day practice. I'll just go through some pictures of aluminum toxicity, like mouth ulcers, effect on the blood cells and the brain cells, Alzheimer's. In Alzheimer's, it's a shrinkage of the cortex, brain cortex, and in the hippocampus, and enlargement of the ventricles. Osteoporosis, pathological fractures, back pain, bone pains, scoliosis, kyphosis, breast cancer. There have been several studies conducted which says that use of antiperspirants, they cause 5 times more chances of having a breast cancer than in a normal person. Deep vein thrombosis, causing plaque formation in the blood vessels, peptic ulcer and appendicitis. Skin cancer, it's the same as the breast cancer because of using of antiperspirants. Constipation, hemorrhoids and proctitis, migraine, endogenous depression. Now, how do we diagnose aluminum toxicity? It's a difficult question to ask. Most of the methods we use here are the indirect methods, like desferoxamine infusion test. Like in a patient who has got aluminum toxicity, we administer desferoxamine And if the symptoms improve, we conclude that it was an aluminum toxicity. Similarly, X-rays of long bones and bone densitometry, they indirectly implicate that it could be aluminum toxicity, although it could be because of so many other reasons. Blood test for anemia, same as that. Anemia could be for any other reason except aluminum toxicity as well. The only method which we say is viable is the bone marrow biopsy to measure the aluminum levels. A proactive approach to prevent the aluminum toxicity. So when we look back at all the symptoms and all the sources of aluminum which we use every day, we can respectively see that what to avoid to prevent aluminum toxicity. So the best way to avoid excess of aluminum is to cut back on the aluminum intake. Use stainless steel cookwares, the coated cast iron cookwares. Use filtered or spring water. Adding magnesium malate or the calcium supplements to the food, they decrease the aluminum load on the body. We prevent use of shampoos and toothpaste which contain aluminum. High fiber diet is known to bind aluminum salts, and apple pectin is considered to be one of the best binding agent. Coffee, black and green tea, cabbage, cucumbers, tomatoes, turnips, they all help in elimination of aluminum from our body because aluminum is more readily dissolved by these acid-forming foods. In a clinical condition, when we have a patient with aluminum toxicity, we use desferoxamine as a chelating agent to remove aluminum from the body. We avoid total parenteral nutrition, which contains a lot of aluminum. We avoid using antacids and perspirants, they contain aluminum, and the use of dialysate, a chemical which we can't avoid when we have dialysis. Now the concept of getting rid of aluminum, apart from avoiding it, we understand that in spite of taking all precautions, we still need to use aluminum every day. Now this brought into question the concept of using the advanced scientific health formulas. Now this is the term which has been designed by the Food and Agriculture Department in USA, which says that these formulas, these products, they oxygenate the cells, they rebuild the collagen matrix, they raise and balance the body's pH levels, they heal and clean the arteries, they regulate the production of hormones, they protect the cells, increase energy, and get rid of heavy metals, and many more benefits. Silicic acid, as sodium metasilicate, is one of the advanced scientific health formulas. It's very widely used and acceptable in the United States of America. A study shows that no Alzheimer's disease in effective absence of the body burden of aluminum. So this is a very significant statement. When we say there's no aluminum in the body, you can't have Alzheimer's disease. And so how to get rid of aluminum? There are a variety of health supplements available now which contain silicic acid. Silicic acid acts by reducing the absorption of aluminum in the gut or by increasing the excretion from the kidneys. A study was conducted where male mice, they were administered aluminum nitrate orally, 50 milligrams in drinking water for 3 months. And another group was given aluminum nitrate along with 50 milligrams per liter of silicic acid. And a significant difference was found in the levels of aluminum in the body, which proves that